a long time, I was scared to share my true color, to be who I truly was. I was hiding in the story I was reading, fearful of what people would think about me. But this ends now. I have stopped running. I decide to accept my diversity. Today, I will share our story of neurodiversity and mental health awareness. Welcome on the ADHD Melly Show. Hello, everybody! I hope you're doing well today. I'm so happy to have you on my show today. And today I'm going to have Alexandria talking about thriving in nursing school with ADHD. So let her come in.
Hi! Hey, girl. Hey, everybody.
I hope you're doing well today.
Yes, wonderful. Alive, wonderful talking to you. Everything. Yes.
Great. So if you're online, if you're here watching us right now, please say hi. I want to just say hi to you and just talk to you at the same time. So like you will see, we are always communicating. And if you have any question for us, go ahead. I'm going to be so excited to just answer all of your questions. So please, can you talk a little bit more about yourself?
Sure. Yes. So I love going by Alex. Everybody is welcome to call me Alex. Definitely familia gets to call me Alex, family. So I am a registered nurse. I live in Ohio and I've lived here my entire life. And I've been in healthcare for, like 18 years now, a long time. And I started off as a nurse aide and then I was an LPN. I went and got my registered nursing license, went back to school, got my bachelor's degree, and now I'm finishing up my doctorate in nursing. So I'll be graduating this May with my doctorate in nursing. And I teach first year nursing students on the weekends at my local community college. I've been doing that for a couple of years now. And over the years, I've precepted and taught hundreds and hundreds of nursing students, and I absolutely love it. Teaching is just my favorite thing.
So talk to me a little bit about your ADHD story.
So my ADHD story is I personally do not have ADHD, but what I have had is many, many students and students, because it always seems like once we get to working, there's all these certifications you can get and all these other programs you can get into. And a lot of nurses have ADHD. But what I come across as being an instructor is nursing students. So students that are in the program, and then they suddenly reveal to you, hey, I've got ADHD. I'm struggling. I'm confused. I can't focus. Or they are thinking about getting into nursing school and they think they can't even do it. They don't even want to attempt to do it. They have this big dream of wanting to be in healthcare in some way. And they just don't think they can do it because they've got ADHD or some type of other learning disability. And what I've loved to do with all of my students is just really empower them, show them all these different strategies, all these different ways of learning so that they can be successful. Because newsflash, there are hundreds and thousands of nurses who have ADHD, who have a learning disability. It does not stop them. You can definitely be in healthcare, have a learning disability, have anything, and still thrive, still survive, still provide great patient care, still live your dream.
Great, that's amazing that you decide to do this for those students. So if I was a nursing student, I know that is not for me, but I mean, as an example, if I wanted to be a nurse and I have a learning disability and attention disability too, because when you're a nurse, you must not lose focus on your patient, right? So what will be your tips for those people that needs to be always focused on care or any kind of job that you really need a big focus? Because if you do a mistake on that patient, it can be fatal, right? That patient can die, So what will you say to those people?
So one of my first things that I always share is that it's okay to be on medication. That is a huge roadblock that certain people see for themselves. They're like, well, I can't be a nurse if I'm on medication, and I can't do this. And what if my nursing school finds out that I'm taking medication? Like it's some big secret that they have to keep. And I'm like, no, please let us know what is going on with you. And I think if you have a really great teacher or a really great school and program that you're working with, they're going to care about you and what you are personally going through. So always share those things, because as an instructor, that really helps me kind of tailor how I'm teaching to provide you the best information that I can. So if you need to be on medication, if you are on medication, that is great. Don't make it a secret. It is not any, you're not any less for doing that. Okay. But what it is doing for you, it is allowing you to be fully present, to be fully focused, so that you can serve patients, so that you can learn the best you can. You can be the best nurse that you can be. So it's okay to take medication. And once you are on the medication, you can get through your program. And if it's for a short time, because sometimes I always relate this back to anxiety and depression, because I know personally I faced that when I was in school. When I was in my LPN program, my dad passed away suddenly. He was living with us, and I had to take care of him. He had a stroke and he had a heart attack. A blood clot went to his brain and he died suddenly. And it was a big shock for me. And here I was in the beginnings of my LPN program. I had two small children and I was grieving. I was depressed. I was anxious. And a part of me felt a little bit guilty for wanting to get on medication, for wanting to seek medication. And I think whether it's anxiety, depression, ADHD, anything else, sometimes we can feel guilty, like it's some fault of ours, but it's not. It's not. You do what you need to do so you can get through the program. And once you're in the thing and in the mix, then you can start looking at what kind of habits are you setting up for yourself? What kind of routines are you getting yourself set into? So that way you can just perform at that optimal level. Medication, no medication, disability or no disability. It really doesn't make a difference in that area, as long as the routines and the habits, and you're taking your medicine and you're doing the things that you need to do so that you can show up and get through and do the best you can.
Absolutely, because like I said in previous show, everybody is scared to tell the truth that they do take medication, but it's okay
Mm-hmm.
if you need them. For me, I'm not taking any medication, but maybe I should. I don't know really more about that. We never know, you know. And I just want to be honest, you know.
Yeah,
And
well,
it's okay if you're you have to tell yourself that you're courageous because you decide to go that way,
mhm,
and not you're not you don't need to be shamed or anything like that, and it's totally okay if you do so, and that's right too. And people are often scared of talking about that, just
mhm,
admit that they need help this way
mhm,
too. And it's not only about the medication, it's also about seeking for help on other people. Like for you, you help people with ADHD, so it's also being courageous to accept that help from somebody else too, you
mhm.
know. And what your patient tells you when they come into your class or your meetings with ADHD, and they're like, I'm not sure if I'm at the right place, I'm not really sure I need that, but you know, I'm just curious. So how do you approach that student?
I'm always one for getting to know my students or whoever I'm working with. I like to get them to know them on like a personal level, like a real person level, because especially now, and this is one thing that doesn't like jive or go along with a lot of traditional like nursing and education, but especially now with the pandemic, we have so much baggage and so much emotional stuff we're all going through, and everybody's situation is so unique and so different. But in a sense, we're all feeling like that pressure and that stress sometimes, and we're all dealing with our emotional issues. And so for me, what I've found over the past 2 years of working with students is just getting to know like the real student and like who they are, not in just in that student role, but like who are they as a person? Because I can't even begin to tell you these personal stories of like, I'm taking care of my mom, or I'm taking care of my grandma at home, or I've got 3 kids and I don't have any support, or I'm working all day and then going to school at night, like all these different situations that students come with. And it's just getting to know the real student and what's really going on with them, so that way I can relate to them. And I probably go way past most boundaries with what I share with patients or with what I share with students, because I'm a real person too. I've had things happen to myself. I'm a mom. I have a life outside of the classroom. And so I think it's important to let them know that I'm a real person and I go through things, and this is how I was able to overcome those things. So that's why I like to share a lot of that. And that's one of my biggest things. And just in life in general is just getting to know people, getting to know the real person, their real story, what they're really going through. And that can help you relate to them on such a better level, make them feel so much more comfortable so that they can be courageous, just like you were talking about.
So, if there's nursing student on my chat right now, or somebody one day come through that video and just feel that they relate to you, what will you say to that person? What kind of tip you will tell her or him
Mhm.
to thrive at nursing school?
To So, one of the things that I always suggest once you start getting into a nursing program or any type of educational type program, and this even goes for daily life too, I'll share for life to get through life as well, is hey, Juana, hey, nice to meet you as well. One of the things I always say is to start creating a daily flow of operation for yourself. The one thing with ADHD especially is, right, we've got all these ideas and all these great all these great things going on, but especially when you are going to be in a certain program for a certain amount of time, right? Because nursing school is not forever. Well, maybe for me because I keep going back to school. But nursing school is not forever. And so when you're in that amount of time for a program, you want to have some steps that you're going to take every single day that's going to make you successful. So you're going to identify things that you need to do, your daily flow of operation of what you need to do to be successful, and you got to stick to it. So you can't make it super complicated. It's just got to be a couple things that you're going to commit to doing every single day to set yourself up, and just make it simple and make it easy to follow. And that's one really great tip, to just kind of I don't know what kind of word I'm trying to look for, to like to like rein in, to like, keep control of our ideas going everywhere and our thoughts going everywhere, and just being able to stay focused on one thing, is create some simple steps that you can follow each and every day. And I like to call it my daily flow of operation.
Great, amazing. So, what do you think you've worked a lot with ADHD people. So what will be the greatest quality on an ADHD person? Because sometimes we always see the bad things, she's not concentrated, she's not anything. And what will you think is the best quality of an
Oh,
ADHD person?
I love this. The one thing, it's the ideas, the fabulous ideas, the nonstop of always thinking. And I think it's so much better to have all these great ideas than just to be like sitting there, not thinking about anything. Let's like Those ideas are great and wonderful, and they're free flowing, and you are like that for a reason. It's meant for you to have all those ideas going and to be thinking all those great and wonderful things. So the only thing I suggest around this is, let's figure out a way to capture all those great and wonderful ideas that you have. So I always think about creating a parking lot. About a parking lot, and you want to have a space for all these really great ideas that you're going to have, and we're going to park them there for a little bit. So as they come, you just kind of park them there, and that way you can come back to it later. You can take a little walk and come back to that later and pick that idea up. And that parking lot could be a notebook, it can be your phone, it can be a calendar, it could be this document that you keep running. Whatever it is that you want it to be, just make some sort of parking lot for yourself that you can just keep adding to and adding to. And then that way later on you can go back to it and pick out one of those great, amazing ideas that you have, and then start creating a DFO, a daily flow around that, so you can make that happen for yourself.
Amazing. Thank you so much for your insight. It's very interesting.
Yeah.
So, I'm going to let you talk and talk to me a little bit more of what you're doing for those students. You already did it previously, but I mean, I'm sure that I want to ask questions, but I don't have them in mind right now, and I want people to just know a little bit more about your work. So I'm letting you talk if you want to talk about a different subject on that nursing school with ADHD. I'm letting you talk about what you wanted to share with other people right now.
Uh, so I guess one of the things that I can really share that, and again, I don't personally have ADHD. I just know from working with all the students that I've had. And mostly my students, I'll be honest, are adult learners, adult students, right? So that can be good and it can be bad. Sometimes adult learners come to me with this idea of they are this type of learner because that's what they were told when they were in grade school, when they were like 8 years old. And I'm like, you're not 8 years old anymore. You're not a little kid anymore. So whatever learning style or whatever they might have told you while you were in school when you were younger, that doesn't necessarily apply or have to be you now that you're an adult. You're an adult learner, and adult learners are so different than the younger learners. And my hope is, right? My hope is by doing what I'm doing and teaching what I'm teaching, we can influence our little younger learners so that they can develop some better habits and a better mindset, a better outlook about themselves and what they're doing as they grow up. But for the most part, I'm dealing with adult learners who have not really heard of neurodiversity or have not been empowered to like embrace their superpower that they have. They've been taught to be ashamed of it and taught to hide it. And oh, I have to hide my medication. I have to hide the fact that sometimes I have difficulty concentrating, or sometimes I don't read the words and they don't come out right, or whatever it might be. No. As an adult learner, you're so different now because you have experienced life. You have all this life experience behind you. And just because you learned one way when you were younger doesn't necessarily mean that's how it has to be as an adult. And as an adult learner, you need to be a little bit more open to trying new ways of consuming information, of learning information. And that can be a real challenge because we can be pretty stubborn. we can we can just want to stick with what we know and what we're used to. And a lot of times we stick and stay with stuff that is not really serving us, is not really that good for us. So being open to trying new things that are going to serve you in a better way as an adult learner is probably one of the other biggest tips that I can give, is to do that. And that's the one other big thing that I see. You're an adult learner, an adult learner now. So let's change how we're used to doing things. Be a little bit more open. Try some new technology. Technology scares everybody, everybody. But don't be scared. But that's the way everything's going now, right? Everything's going virtual. So you're going to have to get comfortable with it. You're going to have to allow yourself to try to learn it and be open to learning it. And if you get a great instructor like me, then it'll be really easy for you and it'll be something that you enjoy. And learning is lifelong. And just because today, when we're talking right now, when you're watching this, in 5 years, you're going to be a different person. And who knows what the technology is going to be like in 5 years.
True.
So you got to be open to learning. That we both are. We're both going to have to be open to learning in a new way and something new. So that's the other thing that I would say about that.
So, what will you suggest for people, when you're a nurse or anything that needs to have priorities? Sometimes when you have ADHD, it's difficult to just find the right priority to make
Yeah.
it first on your list. You have like 10 patients, every patient needs you, but you have to decide which one is the most important. It can be the
Mhm.
same for like homework or any work type. You have priorities to make. So what will be your tip for those people that have difficulty to prioritize properly?
One thing I would say is get used to using timers. timers is such a great way to hold yourself accountable and to keep you focused on a certain amount of task to a certain task for a certain amount of time. And what's really great is if you have ADHD or something else, you pretty much know how long you can focus on something before your mind starts to go somewhere else.
True.
So the trick is to set that timer to that certain amount of time. If you know you have something that you need to work on, you need to study, you need to focus, whatever it is that you're working on, set that timer for just that amount of time or even a little bit less, okay? So set that timer and do it in chunks throughout the day because it does two things. The timer is going to help you to focus for just that amount of time when you can really focus on it. And then when you're done, you let your brain go. You can let it do whatever it is that you want to do. The other thing is it helps with how you learn. So how your brain is going to remember that information because there's something called primacy and recency. So things that you learn first. So when you first start studying, that stuff's going to be in your brain first. So if you start studying, your brain's going to remember that first, and then you take that little break. Then when you go back to it, your brain's going to remember and it's going to take a break. So breaking it up into chunks and having those new memories keep going in, you're going to be able to retain so much more information than just trying to sit there and study for like 2 hours. You're only going to remember like the first couple things that you were reading or doing, and that's about it. You're not going to remember anything else. So using a timer, and you can use your phone, you can use your computer, you can use an old-fashioned alarm clock, you can use whatever you want. Amazon has like cool and crazy timers that, yep, Amazon has really cool ones you can use. Whatever floats your boat, whatever makes you feel good. Go ahead and grab a timer, but they are so helpful and helpful for someone with a learning disability or not. Regular old people, whoever, without that superpower could use a timer. It's a really great thing. And yeah, that's what I have to say on time. I use timers all the time. My son will be like, "Mom, set the timer for 20 minutes," and he just runs upstairs to go do something because I'm so used to like setting blocks of time for stuff. Because if you don't, you just get lost in your day unless you start doing that, and it's really easy to get lost.
And I really suggest you to buy an individual timer because if you put it on your phone, you're probably going to have fun
Mhm.
playing on your phone at the
Exactly.
same time.
Mhm.
So that's very cool. You can just turn it up, your time, and you
Mhm.
change. So I really suggest that. It's like $10 on Amazon, and I always do this now, and I've seen a lot of different on my productivity.
Mhm.
And yeah, because before I was using timer or even a planner, just having
Mhm.
a planner with all the tasks that you have to do in your days. And don't overtask yourself because it's easy to write thousands of tasks that are
Mhm.
impossible to finish through your
Yeah.
day. It's
Mhm.
very important to prioritize and take like 10 minutes before you start your day doing so you have an idea of what you need to
Mhm.
accomplish that day. So that will be my own
Yeah.
tip.
Oh, you are 100% right. Yeah, and so when you're prioritizing, right, and you're deciding those big things that you have to do, you're right. You can overschedule yourself. You can do all of that so easily. And that's really important to be not I always advocate, especially when you're a student, and this kind of goes into the next topic I wanted to talk about. You just
Cool.
introduced it so brilliantly. Um, is is when you plan day to day, you can try to want to fit everything in one day. You're like, I'm gonna be superwoman today. I'm gonna do all this stuff. And it's like, no, don't do that because you will burn yourself out so quickly and there's no possible way you can get everything done. And then you're not even going to be able to have fun in your day because you're filling it up with all this shit you want to try to get done. No. So what and this is one thing that I teach all my students how to do is to time block. And I always introduce them to the concept of time blocking. And I've taught a lot of classes just that specifically teach time blocking. And it's the way that I teach how to organize your schedule. And I've done it for years and years and years. and it has helped me. You can use time blocking for school, you can use it for your health, you can use it for your show, for as a business owner, whatever you have going on, you can use time blocking for. And I always suggest looking at your week. I always take it a week at a time because I'm always one for trying to break things down as easily and simply as I can, because I can do a couple little things each day very easily. And by the end of the week, I got a huge thing knocked out, right? And we don't want to be into the habit of waiting to the last minute, of procrastinating. We don't want to be stressing ourselves out trying to finish everything at once. So I love time blocking because you can lay all your stuff out. You can even put all your big appointments in there first, and then you kind of filter in all the other goodies that you have going on in your life, and be sure to put in time for yourself, to have fun, to go out, to do things, to take care of yourself. And actually, that's the one next area I highly suggest that you plug in next, is the time for you. I always suggest doing that next, and then putting in the study time and the tests, and the I got this podcast here. Let me get ready for this one. Let me write the script over here. Let me send this invite. Then that's when I suggest doing that. But I always schedule yourself first. Put yourself into your schedule first. That's what you got to do. I better look at people's schedules and see their name scheduled in there. Just like you would schedule anybody else, you need to be scheduling yourself. And that's kind of a side. But it is so important. It's so important to put yourself into your own schedule. But time blocking is a great way to help people who have some issues with focusing and have all those great ideas and all the things they want to do. It's a really great way to put it out, lay it out in different blocks throughout your day, throughout your week, and it just helps you stay on task. So the next biggest thing is just make sure you stick to it.
That's artist.
And it takes practice. It takes practice. It doesn't happen overnight, honey. It just takes practice. But if you can start setting yourself up with these good habits and these good routines, and do your best, you do your best. Don't let nobody beat you up just because you missed this or missed that. You keep on track as best you can, because I can guarantee 100% that just doing that is way better than what you were doing before. So, and any little bit helps.
I want to say thank you to everybody that is here
Yeah, thank
today.
you.
Ross, Juana, DJ. I'm so happy to see you
Thank
here
you, guys.
today. You're always here to support my show, and I'm so thankful to see you all the time. So thank you so much for being here again, supporting my show. So thank you so much. So what would you like to talk about next?
What would I like to? I don't know. You know what? Well, do you mind? Maybe I can ask you a question. Would you mind if
Sure, go ahead.
so I would love to know, and I think other people too would love to know, what really made you want to start making this podcast, and how do you keep showing up to do it, and what is what is the bigger Melly Mel goal? Like, what is the big vision for Miss Melly Mel?
I always say that on almost every show, but I'm happy that you ask it because I always have new viewers,
Yeah.
and I always think a little bit more about it and having new plan, new goals, etc., etc. So I decided to open the ADHD Medi show because I suffer from ADHD, of course, but also from anxiety. Because when you have ADHD, most of the time you're going to have other things aside, because you always care when you have ADHD, you're not going to perform well. And sometimes it's people that are going to tell you that they are not happy about you because you're not like them and you're not performing the same way, or you're not just acting the same way than everybody else. I have no idea of how much people just always tell me that. And sometimes clients are like, what the heck? And what do you want me to say? So I decided to just do awareness on ADHD because of that, because I was tired of not being able to find a steady job or a steady contract because of ADHD. And I always have to explain myself all the time, and I got tired about it. So that's why I hoping that it will be 1 years old in June. I just cannot believe that, and I've been able to stick on one thing for almost a year. You know, when you have ADHD, sometimes you always change plan because you get bored. But I'm never bored with the ADHD Millie show. I always have a new guest. You know,
Yeah.
I think if I had to do monologue all the time, I would be bored. Like, you know, I have a podcast and I haven't touched it until August, you know, because I got bored of doing monologues. So I need to find another way to bring back those podcasts, and maybe will I invite people. We'll never know. I'm still thinking about making that podcast work again because I really like that
Mhm.
format too, so
Mhm.
people can just listen to me at the same time. And like I said the other show last week with DJ, I don't want to put those show into podcasts because I want to have new content and share other stuff, you know. I
Mhm.
want to have the TV show and I want to have the podcast. So my biggest dream will be to make an event. I want to make an event in June, so I have some people that are going to be speaker there and just talking about ADHD mental health awareness, and that will be fun in Montreal. Like I said last time, you've been only in Toronto, if I remember right.
Yeah. Yeah. I remember you talking about that. Yeah. But it makes me want to go visit for everything you were telling me.
You should come. You should come. So, yeah, I want to do that event, but I also wanted to produce it on a live show as well. So for
Mm.
that, I will need cameras and stuff like that in the event as well. So that's will be something that I really want to do,
Mhm.
as well as having an office with cameras and stuff like that, and invite my guests
Uh-huh.
over when it's possible. You know, this
Mhm.
is another goal I have for my show as well. I'm not going to stop the ADHD Millie show, and I hope to do a French version of that show too. I already got the YouTube channel for that, so I
Good.
really hope that will work.
Oh, yes, girl. It will. It surely will. It surely will. You know, we need that representation, just like you and DJ were talking before. We need that representation for all the different languages, all the different challenges, adversities, everything. Everybody needs to have somebody they can relate to in that area. And that's what I love about doing the live videos now and meeting people is you share who you are and somebody can connect to that on some level with something that you've gone through. And just like you and I, like we're bonding over this because I may not have what you have, but I have had so many students that tell me those challenges, and I relive it every time I have a new student tell me that, and I'm like, relax. I relax. I got you. Relax. It doesn't matter to me. We'll find a way to help you. And there's so many. They go on, they pass their tests, they do great. They're amazing nurses. And that's the thing. They make like even the best nurses because they have that. And when there's a patient that is like that, they know instantly how to relate to that patient. And that's one of the biggest things that I teach my students really is to how to treat a patient like a person, to how to respect them, how to treat their room like it's a room in their house, how to show that patient so much respect and how to build that trust up with that patient. And if you've got these great nurses running around with these superpowers, then that's so great because they can relate to these patients that they have on another level. And maybe it's not the patient, but maybe it's the son or the daughter that's taking care of that patient, that elderly patient, or that intubated patient that can't speak for themselves. And now you're having to explain to a family member who's got ADHD or some other learning disability what is going on in the most complicated medical terms. You got to break all that down. You got to break all that down and explain it in simple terms so that somebody can understand. And who better to do that than another nurse who has that learning disability that can explain it in a way to that family member? And how good is that going to make that family member feel when they have somebody explaining it to them, not making them feel bad because they might not understand all the words and all the things going on, but it makes them feel so much better. It makes them feel so much more at ease. And I mean, you can't there's no course, there's no nothing that you can teach somebody, that only a person who has that unique ability, that unique power, can relate to another person on that level. You can't teach that, you can't buy that. So that's what I say, if you have this in you and you want to be a nurse, go for it. There are people that need you, that need to hear from you, that need to be cared for by you.
Thanks so much. That's so true. And don't give up if you find a difficulty for anything,
Mhm.
because you have no idea. The ADHD Melly show was not as cool as it's not right now, and that's okay. I remember some time that I was interviewing and there was nobody in the chat, like zero, nada. And I was like, I felt a little bit bad at first, but I was learning and I didn't have any followers. That's normal, And now I have at least 4 to 5 people always on the chat talking about their own struggles. Sometimes they're telling their stories, and that's why I continue the ADHD Millie show, and I wanted to make it work for a very long time too.
It will be. This video will be here. It'll be here for a long, long time.
Oh
And
yeah.
that's the great thing, is that, and this is what I was talking about on my lives for the past couple of days, is I'm making these videos and maybe nobody's watching when I do it live. Maybe nobody's watching, but what the great thing is, it'll be here. And the next time you have a problem, you'll come to your page, they'll come to the ADHD Melly show, and they can type in, I've got an issue with this, and your video will pop up. Whatever interview you did, whatever you happen to have been talking about, is going to pop up, and it's going to solve their problem. It's going to make them feel better. So that's how I look at it now, because girl, I'm right with you. Sometimes you're out there making a video and nobody's watching, and you're like, nobody's listening. But somebody will be eventually. Somebody will find it when they need to hear it. And that's the great, amazing thing.
Yeah. So, what will be your end word? I'm going to end the show right now, and I wanted to know if you had something else that you want to share to others, and I leave in you speaking.
Aw. Thank you. Well, I guess I guess my biggest thing is just as a teacher, like speaking as a teacher, speaking as an instructor, but also speaking as a nurse. Times are tough. Times are tough right now for healthcare providers, but it won't always be this way. And I see all of you nursing students out there struggling, and I know virtual clinical is not the clinical you envisioned and the clinical that you want to go through, but we as instructors and teachers are doing the best we can to make it enjoyable for you and to get you through this, because we know you have an end goal. We know you want to be that nurse, or we know you want to be that respiratory therapist, or we know you want to be whatever program you're in. We know you want to get there. We're doing the best we can to get you there with what we have. But what my hope is, and what I'm hoping to do, is to kind of make that a little bit easier for other teachers out there, get them used to being on screen, on camera, and let other teachers know that this is the time to share your stories and what you're going through, and how you feel about your students, and the messages that you want to tell your students, that maybe sometimes in the classroom it's not the right time to say that to them, but here, honey, in the virtual world, you can say whatever you want. So this is kind of my message, and this is kind of why I've been making videos and doing all of this, is just to really share my thoughts and my perspective on teachers and on education, and specifically with your show, with this type of student that we have all the time, that unfortunately maybe some have slipped by me that I never knew about because they didn't want to tell me, because they were ashamed, or because they felt awkward telling me. But this is kind of my signal out there to tell people, don't be ashamed, don't be afraid. Let people know what's going on with you, how you're feeling, what you're going through. And if you have a really great teacher, you have a really awesome teacher, which there are great teachers out there, they will love to hear that from you and work with you and do everything that they can so that you can be successful. So that's just my biggest takeaway, is let us know, talk with us. We are people too. And I can relate to each and every one of my students. Just tell me what is going on with you so that I can really help you the best I can.
And don't forget, COVID's not going to last forever. I know you work too many hours if you're already a nurse and you have no breaks and no day off. But
Yeah.
tell yourself you're making money right now, and one day you will have your break that you do deserve.
Yeah.
And thank you so much for saving those patients that needs you right now, and not give up. That's what
Thank
I'm going to say to the nurses and to you too.
Yeah. Yeah, thank you. Yep, thank you to everybody. Yes.
So thank you so much for being here, everybody. We're going to leave you now, and thank you so much, so much for joining me. So we'll see you next week at 1 p.m. Eastern Time next Friday.
Bye.
Bye, everybody. Ciao.
Ciao.
For a long time, I was scared to